I won't share screen. I guess I can. All right. Oh, I can't. It's a window. Okay. Actually, we'll stop sharing. Okay. Okay, that should be fine. Hello. So if anyone watches this, again, just like what the intro thingy says, so I'm studying for my EPPP exam, and to begin, I'm doing an assessment exam to figure out where my knowledge is on the information that I'm going to be tested on, sorry. So yeah, so that's kind of where I'm at. I tried to share the screen, but I'll have to figure out a different setup if I plan on continuing live streaming my study sessions. So we'll see how that goes. I guess it depends, but I guess it'll be mostly quiet. Maybe I'll start learning to add music, but we'll see. But anyways, I'm going to start doing the test now. I'm doing the untimed version. Oh, speaking of which. Okay. I need to figure out how long it's going to take me to write the exam. No, stopwatch. Okay. Okay, we're going to... All right, this is going to be fun. Okay. Cognitive behavioral treatment for panic disorder involves interoceptive conditioning. This type of conditioning may include which of the following strategies? I don't fucking know. Okay, so interoceptive. So it's something about some type of thing. Yelling stop whenever an undesirable thought occurs, maintaining a panic diary, focusing on a pleasant experience or fantasy, breathing through a thin straw. Obviously not that. Cognitive behavioral treatment. So CBT. CBT is about actions, feelings, and thoughts. Focusing on a pleasant experience or fantasy. That seems more somatic. Maybe not. Interoceptive conditioning. You know what? I'm gonna say focusing on a pleasant experience or fantasy. Because you're conditioning yourself for something. So it can't be a panic diary. Yelling stop, or it could be yelling stop. CBT. I'm gonna say, you know what? I'm gonna say yelling stop. Okay, we're gonna do that. Next question. Okay. The assumption underlying dialectical behavioral therapy as a treatment modality for borderline personality disorder is that the symptoms of this disorder are caused by, oh, that's a great question. A lack of response, contingent reinforcement, the depressive cognitive triad, dysfunctional object relations, pervasive emotional dysregulation. I think it's A or B. Shit. Okay. Let me see what the question is. The assumption underlying. Okay, so basically, what's the main idea of dialectical behavioral therapy? So, the main idea. Pervasive emotion dysregulation is a part of it because there's 4 main skills. So, I'm going to say B. Okay. Question 3. The revised learned helplessness model proposed by Abramson, Metalski, and Alloy identifies blank as the primary contributing factor for depression. Learned helplessness. Oh, that was by, what's his face? His name started with an S. Identifies blank as the primary contributing factor. The revised learned helplessness model. The depressive cognitive child, emotional oversensitivity, a high rate of self-punishment, hopelessness. Blank as the primary contributing factor for depression. I feel like hopelessness was the first one. I don't know, my gut says A. Okay. Desiree D, age 21, displays several active psychotic symptoms, including persecutory delusions, auditory hallucinations, incoherence, and loosening of associations. Her symptoms began suddenly 3 months ago, and she has no previous history of similar symptoms. Which of the following is the best diagnosis for her symptoms? Persecutory delusions, that could be schizophrenia, auditory hallucinations, incoherence, and loosening of associations. It could be, but it's not doing any of the positive or negative symptoms. And I don't know which ones. So loosening of association sounds like losing track. Displays several active psychotic symptoms. But she hasn't had the symptoms long enough to be schizophrenic. And I don't know the time frame for each of these. Her symptoms began suddenly 3 months ago, and she has no previous history of similar symptoms. You know what? Because all of them are schizophrenia and one of them isn't, I'm gonna just say B. All right. The prognosis for a child with autism is best if the prognosis for a child with autism is best. So, does not have delays in motor development, displays some ability to communicate verbally by age 5 or 6. No, because there's nonverbal as well. Has one or more savant abilities. That's a stereotype. Does not have a family history of a mental disorder. The prognosis for a child with autism is best. Oh, prognosis. Okay, so basically the best outcome. Okay. I think it's displays some ability to communicate verbally. The prognosis for a child with autism is best if. So then that means they already have autism. Does not have a family history of a mental disorder. I think it's B. Okay. Okay. The diagnosis of cyclothymic disorder for children and adolescents requires the presence of symptoms for at least cyclothymic disorder. I actually don't know, which I should. Okay. The diagnosis of cyclothymic disorder for children and adolescents requires the presence of symptoms for at least, because it's children, cyclothymic. So something to do with the thyroid? No. Thiamine. Where is that? I feel like that's for the brain. I'm gonna just say 12 months. I actually don't know. Okay. The DSM-5 diagnosis of bipolar 2 disorder requires which of the following? Oh, fuck. Bipolar 1 and bipolar 2. I don't know the difference. Okay. Because I don't work with this. One or more manic episodes. One or more mixed episodes. Manic and major depressive episodes. Hypomanic and major depressive episodes. Okay. Manic and major depressive episodes. The DSM-5 diagnosis requires which of the following? Okay, so it has to happen. Okay, we're going to say C. I actually don't know. Okay. Based on DSM-5 criteria, the diagnosis of ADHD requires which of the following? I have ADHD and I actually don't know. Based on the DSM-5 criteria, the diagnosis, the onset of symptoms prior to 4 years of age, I think that's wrong. Duration of symptoms of at least 6 months, markedly impaired academic performance, negativistic, hostile, and defiant. Okay, that's not it for sure. Based requires which of the following? Okay. Is 4 years of age correct? The onset of symptoms prior. That feels wrong. Prior to age 4? Because it's childhood. So it's either B or C. Duration of symptoms of at least 6 months. I'm going to say C. Okay. Because usually it's longer. Okay. According to the catecholamine hypothesis, I don't remember. Okay. Catecholamine. Okay, mania is due to a deficiency in norepinephrine. Depression is due to a deficiency in norepinephrine. Mania is due to excessive acetylcholine. Depression is due to excessive acetylcholine deficiency. Yeah, you're not wrong. Okay. According to the catecholamine hypothesis, I don't have it memorized. Mania is due to a deficiency in norepinephrine, acetylcholine. Oh, it can't be norepinephrine. That's the adrenal system. So, because we're talking about, are we talking about neurotransmitters or are we talking about the endocrine system? So, the answer must be something to do with acetylcholine. Okay, so mania is due to excessive acetylcholine. Depression is due to excessive acetylcholine. I think it's C. Okay. The prognosis for schizophrenia has been linked to several factors. Which of the following is not associated with a better prognosis? Which is not associated? Okay. Male gender, family history of a mood disorder, the presence of a precipitating event, acute and late onset of the disorder. The prognosis of schizophrenia has been linked to several factors. Which of the following is not associated with a better prognosis? So which of these is not associated with a good prognosis? Probably being male. That's my guess. The most effective treatment for obsessive compulsive disorder is, okay, so OCD, obsessive tendencies, exposure therapy with response prevention, stress management with relaxation training, covert sensitization, stress inoculation training. Okay, so I'd have to know what the symptoms are of obsessive compulsive disorder. It's not a personality. Covert sensitization, stress inoculation training. I don't think it's those. The most effective. Okay, so basically what's the best? That seems like conditioning. I'm gonna say stress management. Okay. A 45-year-old woman exhibits several symptoms, including autonomic hyperactivity, hand tremor, and nausea following cessation of prolonged and heavy alcohol use. A diagnosis of alcohol withdrawal delirium would be more appropriate than a diagnosis of alcohol withdrawal if the woman also exhibits. Okay, let me read that again. A 45-year-old woman exhibits several symptoms, including autonomic hyperactivity, hand tremor, and nausea following cessation of prolonged and heavy alcohol use. So basically, they're saying that these could be for both. A diagnosis of alcohol withdrawal delirium would be more appropriate. So, which one of these symptoms goes under alcohol withdrawal delirium? Alcohol withdrawal delirium. Tardive dyskinesia is a type of tremor. Okay, we're going to say seizures. Because I feel like that happens for both. Like, yeah, okay, we're going to say that. Okay, according to Marlatt and Gordon, 1985, which of the following results from an overlearned habit pattern? Wait, what? Form an overlearned habit pattern. According to Marlatt and Gordon, I don't know this article, which of the following results from an so which of the following results from an overlearned habit pattern? So what is an overlearned habit pattern? An overlearned habit pattern. Which of the following results from an overlearned habit? Yeah, this is where I need to know what an overlearned habit pattern is. Hypochondriac, paraphilias, an overlearned habit pattern. My gut says if it's a habit, yeah, we're gonna say this one. Okay. Children with Tourette syndrome frequently exhibit significant problems in learning. This is most likely attributable to attention deficit, lower than average IQ, peer and other social problems. Significant problems in learning. Okay, it's not IQ. I don't know the comorbidity rate with Tourette and ADHD. Peer and other social problems. Language disabilities. Children with Tourette syndrome frequently exhibit significant problems in learning. So there's issues with learning. This is most likely. So what is the reason behind it? Yeah, we're just going to say this. Okay, a DSM-5 diagnosis of specific learning disorder requires the individual's academic skills to be substantially below those expected for their. A DSM-5 diagnosis of specific learning disorder requires the individual's academic skills to be substantially below those expected for their. Okay, what would be chronological age, mental age, measured intelligence, academic aptitude? Okay, so what academic? Okay, we're just going to do academic aptitude because we have academic in the sentence. Okay. As described in the DSM-5, a manic episode involves a period of abnormally and persistently elevated, expansive, or irritable mood. And, okay, manic episodes, that's when people are on their high. Period of abnormally and persistently elevated, expansive, or irritable mood, and persistently increased activity or energy. Involvement in activities that have a high potential for negative consequences. Anxious distress. I don't think they're as anxious. Involvement in activities that have a high potential for negative consequences. Inflated self-esteem or grandiosity. Persistently increased activity or energy. As described in the DSM. So what does the DSM say? I want to pick the longest. Okay, we're going to say A. Okay, Ethel E., age 36, has been offered a promotion at work. Although she wants the increase in salary and prestige of the new position, she is planning to turn down the job because it will require extensive speaking in front of large groups of employees. Ethel has avoided situations that require her to speak to groups for as long as she can remember because public speaking is a very embarrassing experience for her. Whenever she has to speak in front of others, she's extremely anxious, her heart races, her palms become sweaty, and she becomes preoccupied with the concern that she will forget what she has planned to say. Ethel's symptoms are most suggestive of which of the following disorders? Yeah. Yeah, I don't think it's panic. Yeah, okay. The prevalence rates of major depressive disorder are about equal for boys and girls before puberty. In adolescents and adults, no, the rate. I think it's between these two. Let's say this one. Okay, a psychologist should not assign a diagnosis of disruptive mood dysregulation disorder for the first time if the individual is younger than blank years of age or older than blank. Disruptive mood dysregulation. I genuinely don't know. We'll say B, because I actually don't know. Research outcomes have linked obsessive compulsive disorder to overactivity in which of the following? Oh, okay, so this is a cognitive one. Research outcomes have linked OCD to overactivity in which of the following? Caudate, hippocampus, supranucleus, medulla oblongata. Okay, hippocampus. This would be helpful if I remembered. I forgot. Suprachiasmatic nucleus. I don't think it's the medulla. It might be. Honestly, I don't know. Hippocampus. I forgot what the This has to be a guess because I genuinely research outcomes have linked obsessive compulsive disorder. I'll just say this. Okay. Okay. A DSM-5 diagnosis of somatic symptom disorder requires the presence of one or more somatic symptoms that are distressing or cause significant disruption in daily life, plus a DSM-5 diagnosis of somatic symptom disorder requires the presence of one or more somatic symptoms that are distressing or cause significant disruption in daily life, plus condition, performance of excessive health-related behaviors or not made or voluntarily produced, excessive thoughts, feelings. Okay. In the DSM-5, sleep terror is included, with the sleep-wake disorders as a separate diagnosis, as a type of rapid eye movement behavior disorder, as a type of non-rapid eye movement sleep arousal disorder, nightmare disorder. We'll just say that because I have no idea. Okay. Drugs that interfere with the breakdown of blank are used to treat memory loss and other cognitive problems in individuals with mild to moderate Alzheimer's. Alzheimer's is dopamine. Drugs that interfere with the breakdown of blank are used to treat memory loss. Yeah, dopamine. The differential diagnosis of major depressive disorder and mild neurocognitive disorder in older adults can be difficult because of the overlap in cognitive symptoms. However, the presence of which of the following suggests that major depressive disorder is the more appropriate diagnosis. Presence of which of the following suggests that major, okay. Insidious, the severity of the patient's cognitive. Neurocognitive disorder. The presence of which of the following suggests that. I actually don't know. Rosita R., age 32, maintains systematized paranoid delusions despite a lack of evidence for her beliefs. However, she shows almost no impairment in daily functioning other than some problems that are directly related to her delusions. The symptoms began 6 months ago, shortly after she was fired from her job. The most likely DSM-5 diagnosis for Rosita is, age 32, maintains a systematic paranoid delusion despite a lack of evidence for her belief. She shows almost no impairment in daily functioning other than some problems that are directly related to her delusions. Okay. A DSM-5 diagnosis of erectile disorder requires the presence of characteristic symptoms for a minimum duration of approximately, I believe, That's just a safe bet. A better prognosis for schizophrenia is associated with the following, except. Okay. In the DSM-5, the symptoms of oppositional defiant disorder are characterized into 3 groups. These groups are, I don't know. Okay. In Berry's bidirectional acculturation model is characterized by low involvement in one's own minority culture and in the majority culture. Probably alienation, or it's marginal. In Berry's bidirectional acculturation model, blank is characterized by low involvement in one's own minority culture and the majority culture. Um, I feel like it's alienation. Okay. Freud described countertransference as the analyst's transference to the patient, which may interfere with the analyst's functioning in therapy. More recently, psychoanalysts have begun to view countertransference as okay. Okay, researchers interested in evaluating the outcomes of psychotherapy distinguish between effectiveness and efficacy research. In contrast to effectiveness research, efficacy research effectiveness. So if something is effective, efficacy. I feel like it's one of these two. I think it's this one. Studies have shown that psychotherapy research participants in placebo control groups typically show greater improvement than those in no treatment or waitlist control groups, less improvement than those in no treatment or waitlist control groups, similar improvement to those in no treatment or waitlist control groups, no improvement when compared to no treatment or waitlist. Oh, yeah, I think it's that. That makes the most sense. The belief that a child's misbehavior has one of 4 goals: attention, revenge, power, or to display inadequacy is most consistent with. Oh, interesting. Okay. The belief that a child's misbehavior. So, who studied misbehavior? Yeah, it's not those. I think it's Maller. Because object relations is about people. Okay. Asking the miracle question is an initial intervention in which type of therapy? Isn't that solution focused? Yeah. Okay. Oh, I have some knowledge because goddamn, I've been feeling stupid. Okay, solution focused therapists utilize all of the following interventions except. So all of them are right, one is wrong. Scaling questions, so reflective questioning. For a Gestalt therapist, a primary goal of treatment is to help the client integrate the present with their past and future, integrate the various aspects of the self, develop a success identity, develop a healthy style of life. I think it's B. Because, like, Gestalt is all about, like, parts. Yeah. Research on Helm's white racial identity development model suggests that a white therapist will usually be most successful when working with a client from an ethnic racial minority group when the therapist is in which stage? I actually don't know. I need to look this up. Integrative awareness, autonomy, immersion, reintegration. White therapists will usually be most successful. Probably integrative awareness. I don't know. The primary goal of a newly developed community-based mental health program is to help people recently discharged from a psychiatric hospital adjust to life in the community. This is an example of the primary goal of a newly developed community-based mental health program is to help people recently discharged from a psychiatric hospital adjust to life in the community. It's not crisis intervention. Developed community-based mental health program is to help people recently discharged from a psychiatric hospital. I don't know, secondary prevention. Okay. Culturally sensitive approaches to psychotherapy vary from traditional approaches in that these approaches attempt to understand a client's experience of an illness within the client's cultural context. Thus, culturally sensitive approaches are rooted in a blank perspective. Shit, it's emic or etic. I learned about this so long ago. It's emic or etic. I think it's emic. I think emic. Yeah, we're going to say that because I don't remember. Okay, Margaret Mallard proposed that the development of a sense of self is related to assimilation, accommodation, projective identification, separation, individuation. This would be great if I knew. We'll say projective identification because I actually don't know. Pseudo mutuality. Yeah, I don't think so. Carl Jung believed that a client's transference is a fantasy that distracts a client from reality. Represents mixed feelings toward the therapist, is a form of acting out, reflects the client's personal and collective unconscious. We'll say that just because they used unconscious and Carl Jung is psychodynamic. Okay. Smith, Glass, and Miller's meta-analysis of the psychotherapy outcome research 1980 found that people receiving therapy are better off than about blank percent of people who need treatment but do not receive it. Found that people receiving therapy are better off than about I don't know. According to Howard et al.'s phase model, 1996, which of the following is most likely to be affected during the first few sessions of psychotherapy? So, phase model. I don't remember the phase model. Which of the following is most likely to be affected during the first few sessions? So, what is the phase model? That's where my knowledge base would have to be. Maladaptive, severity of symptoms, coping skills. We'll say maladaptive behaviors. I actually don't know. Oh, this is making me feel really dumb. In client-centered case consultation, the consultant's primary goal is to, in the client-centered case consultation, the consultant's primary goal. Okay, so what's the therapist's primary goal? Help the client determine how to work more effectively with a, oh shit. Oh, a case consult. Okay. So in client-centered case consultation, the consultant's primary goal, okay, it's like supervisor there, like supervisor, supervisee, help the consultee determine how to work more effectively with a particular client, help the consultee identify methods for evaluating their own professional services, help a consultee enhance their skills and knowledge so that the consultee functions more effectively in the future, work collaboratively with the consultee to jointly deliver an appropriate intervention to a client. Probably this. That makes the most sense. Research on cross-cultural mental health presentation suggests that some clients from cultures that place a strong emphasis on emotional restraint and stigma regarding mental illness may be more likely to prefer non-directive therapy. No. Focus primarily on past or no. Delay discussion of treatment goals. No. Express psychological distress through physical symptoms. Yeah, that makes no sense. From the perspective of feminist therapy, therapist self-disclosure is necessary. Contra for feminist therapy. Yeah, I don't think it's contraindicated because it puts the client in a passive role, necessary during the early stages of therapy to encourage the client's participation, a means of fostering a special bond between the client, a useful for promoting an egalitarian relationship between the therapist and client. That makes the most sense due to the language used. The first stage in crosses something model of Black racial identity development is, I don't remember. The first stage in this model of Black racial identity. Maybe pre-encounter. But that's if it's included. Contact. Conformity would probably. The first stage. I actually don't know. Okay, fuck it, we're saying conformity. Okay, replacing a failure identity with a success identity is a goal of treatment for practitioners of blank therapy. Adlerian. Or is it? I think it's Adlerian. Identity. I think it's reality. Fuck it, we're saying Adlerian. My gut is saying Adlerian, so we're going to say Adlerian. Okay. Prochaska and De Clemente's Stages of Change trans-theoretical model, okay, so addictions, predicts that a person in the blank stage plans to take action within the next 6 months that will alter their problematic behavior. Predicts that a person in the blank stage plans to take action. Plans. So preparation. Because they're preparing. Okay. People in which of the following stages of Atkins, Morton, and Sue's racial cultural identity development model begin to question their rejection of all aspects of the dominant culture and absolute loyalty to their own culture? Shit. Following stage: dissonance, integrative awareness, introspection, encounter. Question their rejection. Dissonance. Like dissent. Like cognitive dissonance. It's like distance. I'm gonna say integrative awareness. It could have been dissonance. A family therapist using the structural approach of Salvador Minuchin would most likely clarify boundaries between family members in order to reduce enmeshment, work initially with the most differentiated family member, use a multiple therapist team to prevent any one therapist from becoming triangulated into the family system, issue specific directives designed to counteract dysfunctional processes. That's a good question. Honestly, I don't know. So I'll say this. I don't have enough background. I forgot. According to Irvin Yalom, blank in group therapy is the analog of the therapist-client relationship in individual therapy. Alliance? No, cohesiveness. Yeah, that's going to be my guess. It's either cohesiveness or universality. I don't remember the language that Yalom uses. In group therapy, blank in group therapy is the analog of the therapist-client relationship, alliance, because you don't want identification. I don't know why I want to say universality, but alliance makes the most sense. Okay, it's universality. We're going to say that because individual therapy uses the word alliance. According to Freud's notion of blank, dreams and slips of the tongue are meaningful goal-directed phenomena. Psychic determinism, reciprocal determinism, psychic dynamigenesis. Probably, we're going to say psychic determinism because like it was all about the psyche. Let's hope. The information that family members continuously exchange and that helps minimize deviation and maintain the family stability is referred to as blank feedback. The information that family members continuously exchange and that helps minimize deviation and maintain the family stability. External, no, internal, negative, positive. A negative feedback loop. Probably negative, because nothing's being added. But I'm probably, no, we're going to say negative. Because positive feedback loops, no, that's only for birth. My bad. When working with families from diverse cultural backgrounds, psychologists should assume traditional gender roles are present, expect hierarchical decision-making patterns, assess each family's structure and role organization, compare family functioning to dominant cultures. Okay, none of those. So we'll just say assess each family structure. So that makes no sense. In the context of structural family therapy, the purpose of reframing is to diffuse blame, relabel behaviors, increase specificity, anchor, relabel behaviors. That makes the most sense. Okay, which of the following statements is an acceptable description of a research participant as per the APA publication manual? Which of the following statements is an acceptable description of a research participant? Okay, so whatever the APA publication manual said, acceptable. A non-white participant, physically challenged, participant diagnosed with borderline, participant suffering from multiple sclerosis. Which of the following is an acceptable description? Probably not these two. Probably C. Because it's research, so it has to be clinical. So we're going to say that. That is my thinking and logic. A psychologist is most likely to have vicarious liability. Fuck, I don't remember. Okay, vicarious liability when acting in which of the following capacities? Faculty member, supervisor, mentor, therapist. Vicarious liability. supervisor. Yeah, that makes the most sense. When serving as an evaluator in a child custody case, a psychologist's primary concern should be the child desires, maintaining a position of neutrality, the best interest of the child, the best interest of the person who hired this. Okay, not that. Best interest of the child, maintaining a position of neutrality. Primary concern. Evaluator. So you're evaluating. So it's either B or C. When serving as an evaluator in a child custody case. So it's neutrality. That makes the most sense. A practitioner billed her client's insurance company for a completed appointment. The provider did not report that the client canceled her session with less than 24 hours. A practitioner billed her client's insurance company for a completed appointment. The provider did not report that the client canceled. The provider did not report that the client canceled her session with less than 24 hours until the appointment start. I think it's that. That makes. We're going to say that. Good luck for you. Oh, I appreciate it. Thank you. I appreciate it. Okay, a former client owes you over $600 in therapy fees, and you are considering using a collection agency to collect the money she owes you. As an ethical psychologist, you should decide not to do so. Decide not to do so because using a collection agency is prohibited by the ethical guidelines. I don't think so. Do so only if you inform the client at the beginning of therapy that you would do so if she did not pay her fees in a timely manner. Contact the client first to inform her of your intent to use a client if she does not pay. I'm going to say this because you're contacting them and they're aware. That makes the most sense. Oh my God, I have so many. Okay, no, I got this. You have been seeing Leticia Lopez in therapy for several months. Leticia is 24 years old and lives with her widowed mother, who is paying for Leticia's therapy. One day, Leticia's mother calls and says she's very concerned about Leticia and wants to know what she can do to help Leticia feel better about herself. Mrs. Lopez asks that you not tell Leticia that she has called. Your best course of action in this situation would be to, she's 24, so confidentiality. Give Mrs. Lopez the specific advice she has requested. No. Tell Mrs. Lopez to ask Leticia what she can do to help her. Tell Mrs. Lopez that it would be best if you discuss this matter with Leticia. Suggest that Mrs. Lopez accompany Leticia to her next therapy session. Probably C. That makes the best bet because you need to communicate with your client. Yeah, okay. Which of the following best describes APA ethical guidelines regarding sexual intimacy with former therapy clients? That's a no-no. Psychologists are prohibited from having sexual intimacies with former clients under any circumstances. That's what my guess is. Are not prohibited? No. Psychologists are prohibited from having sexual intimacies for 2 years, and after that, no. Prohibited with former clients for at least 1 year. Yes, none of those. Yeah, okay. It's never. Yeah, I don't know why you would ever want to sleep with a client. That's gross. In most situations, the holder of the privilege is. Okay. In most situations, the holder of the privilege is the therapist, the therapist and client jointly, the court. The therapist. Okay. Dr. Jones, a clinical psychologist, has been seeing Lisa L. in therapy for 1 month. Dr. Jones considers Lisa to be a very attractive woman and finds himself having sexual fantasies about her. Yikes. As an ethical psychologist, Dr. Jones should recognize that such attraction is normal but proceed with caution. Confess his attraction? No. Recognize that such attraction is inappropriate and refer Lisa to another therapist without explaining the reason to her. Continue working with Lisa, but consult with a colleague if he believes his attraction might be interfering with his objectivity. Okay, let me see. Okay, let me reread this question. Clinical psychologist in therapy for 1 month considers Lisa to be very attractive and finds himself having sexual fantasies about her. As an ethical psychologist, confess no. Recognize that such attraction is normal. Okay, no. Continue working with Lisa, but consult with a colleague if he believes his attraction might be interfering with his objectivity. Recognize that such attraction is inappropriate and refer Lisa to another therapist without explaining the reason to her. Okay, we're gonna say this. Okay, the primary function of the Psychology Licensing Board is best described as limiting access to the profession, providing sanctions for unethical and illegal behavior on the part of psychologists, protecting the public welfare, accrediting graduate programs in psych. Shit. Psychology Licensing Board. Licensing Board. I think it's limiting access to the profession. Providing sanctions of unethical and illegal behavior on the part of psychologists. I don't think it's that. Providing sanctions for unethical and illegal behavior. The primary function of the Psychology Licensing Board. Shit. We're going to say that. Okay. Which of the following best describes a true statement based on ethical guidelines for the use of deception in research? Deception is prohibited in all. Have given limited consent after being told about the general nature of the study. Deception is prohibited whenever it involves deceiving potential participants about aspects of the study that would affect their willingness to no. Deception is prohibited except when the purpose and design of the study require the use of unobtrusive measures. I think deception is just prohibited. That's what I'm saying, because yikes. If it's not, which of the following statements best describes a researcher's obligations regarding the use of animals in psychological research? Shit. I gotta review all this. Animals should never be used in research when alternative procedures are available. Probably correct. Which of the following best describes? Okay. Animals should never be used in research if a research procedure will cause them pain or harm. Yeah. Inflicting pain or stress on animals is acceptable in research only when an alternative procedure is unavailable and use of the procedure is justified by the potential value of the study. Inflicting pain or stress on animals is acceptable in research as long as it is minimized and the animal's life is terminated as soon as is feasible. Damn. I actually don't know because, like, a lot of neuroscience research tests on rats and they do surgeries. They implant things. But is that neuroscience and not psychology? No, there is psychological research where, like, they test mice, but they don't do neuroscience implants. Okay. Yeah, I'm gonna say B. Okay. Okay, mix that up a little bit. All right. Dr. Lopez is the only psychologist in a small town, and his son is enrolled in the town's only elementary school. Dr. Lopez receives a call from his son's teacher who says she would like to begin therapy with Dr. Lopez. As an ethical psychologist, Dr. Lopez should tell the teacher that he is ethically prohibited from seeing her because to do so would constitute a multiple dual relationship, begin therapy with her and discuss the potential for conflicts during the initial session, and if necessary in subsequent sessions, begin therapy with her but seek consultation if any problems arise, begin therapy with her but take special precautions to ensure the client confidentiality is maintained. Probably B, because it's a small town, you're limited, you don't have a choice. Yeah, okay. Dr. Harold Hansen, a psychologist who heads the personnel committee at a mental health facility, recommends that a psychologist who has an unresolved charge of sexual harassment against him not be considered for promotion. In terms of his ethical responsibilities, Dr. Hansen, a psychologist who heads the personnel committee at a mental health facility recommends that a psychologist who has an unresolved charge of sexual harassment against him not be considered for promotion. He has acted ethically since sexual harassment is explicitly prohibited by ethical guidelines, as long as he's willing to consider the psychologist for promotion if he is acquitted of the harassment charge. He acted ethically as long as his decision is consistent with the stated promotion policy of the mental health facility. He acted unethically by violating the requirement of the ethical root case, not that. Okay. He acted ethically as long as he is willing to consider the psychologist for promotion if he is acquitted of the harassment charge. Has acted ethically as long as his decision is consistent with the stated promotion policy of the mental health facility. We'll say B because, yeah, that makes the most sense. Okay. A graduate student's dissertation chair, Dr. X, turns out to be of little help, and the student ends up obtaining advice and assistance from an associate professor, Dr. Z or X. Oh, sorry, Dr. Z, Dr. X does review the dissertation when it is completed, and she is listed as the dissertation chair. Several months later, the student decides to write an article for a professional journal that is based on the student's dissertation research. In terms of publication credit, Dr. Z should be listed as first author if her contribution was substantial. Dr. Z should be listed as a second author for contribution. Dr. S should be listed as second author since she was a student's official dissertation chair. I actually don't know. Shit. Okay. A graduate student's dissertation chair, Dr. X, turns out to be of little help, and the student ends up obtaining advice and assistance from an associate professor. Okay, co-authors? I don't know. Yeah, I'm gonna say co-authors because it's their dissertation. Okay, I'm gonna say that. Dr. Marcos Manzetti uses a sliding scale that is based on a client's current income to set his fees for therapy. Dr. Manzetti's practice is ethically acceptable since it serves the best interests of his clients, explicitly recommended in the ethical guidelines, ethically unacceptable since it treats clients inequitably. No. Explicitly prohibited. No. Explicitly recommended in the ethical guidelines, ethically acceptable since it serves the best interests of his clients. I don't think it's explicitly recommended. I don't think you have to have sliding scale. It's just nicer. When consulting with a colleague about a therapeutic impasse, When consulting with a colleague about a therapeutic impasse you are having with a therapy client, which statement applies? It is always necessary to advise the client about the consultation. It is necessary to get a signed waiver of confidentiality from the client before discussing any information with the consultant. It is unnecessary to advise the client of the consultation as long as only information that is relevant to the impasse is discussed. It is unnecessary to advise the client of the consultation. That's my guess. In terms of ethical guidelines, providing pro bono service is recommended. Discouraged, prohibited, required. I don't think it's required. Dr. Isaac Ibrahim, a licensed psychologist, wants to expand his private practice. When doing so, he should keep in mind that uninvited in-person solicitations for therapy clients are. Wait, what the fuck did that say? A license wants to expand his private practice. When doing so, he should keep in mind that uninvited in-person solicitations. I actually don't know about this. Can you tell someone to see you? I mean, that just seems grimy, but that's a personal feeling. It's not, I don't think it's always not ethical, obviously. Unethical when the solicited individuals are susceptible to exploitation or undue influence. I'm gonna say always unethical. I feel like that's wrong, but it is what it is. Okay. A student participant in a research study involving matched pairs decides to withdraw from the study. The chief investigator, who is a licensed psychologist, stresses to the student the importance of this data to the study, but the student insists that his data be withdrawn. The investigator should, they're allowed to withdraw. Allow the student to withdraw from the study. Tell the student that his name will be removed from all data and include his data in this. Oh, God, no. Remind the student that he signed an informed consent and cannot now request that his data be withdrawn. No, you have to allow them. What do you mean? It's all voluntary. Okay. Dr. Pavel Petrovich, a licensed psychologist, has been seeing a client in therapy for over 14 months with no apparent change in the client's symptoms. Dr. Petrovich should advise the client that he is ethically obligated to terminate, raise for discussion the possibility of terminating referral, search the literature for discussions for similar cases that have been treated and report for others, continue seeing the client since 14 months is not. No, raise for discussion, search the literature. Maybe raise for discussion. I'm gonna say that. Okay. The Buckley Amendment establishes, I don't know, I just think of cough medicine. The right of parents or legal guardians of a child to inspect the child's school records. The Buckley Amendment. The right of patients to have access to their own hospital records. The requirement for employers to make responsible modifications to tests for applicants with disabilities. The requirement for schools to provide a free, appropriate public education to students with disabilities. The Buckley Amendment establishes. So it's amendment on something. The right of parents to legal guardians of a child to inspect the child's school records, the right of patients to have access to their own hospital records, the requirement for employers to make reasonable modifications to tests for applicants with disabilities, the requirement for schools to provide a free, appropriate public education to students with disabilities. I honestly don't know. Okay, that's about school. That's about school. I'm gonna just say the right for patients to have hospital because that is the only thing not about school. So we're gonna say that. Okay, Dr. Carl Carlson is a licensed psychologist and professor in the psychology department at a large university. He is approached by a graduate student, Marla M., age 36, who asks him if he'd like to attend a baseball game on Friday night. Dr. Carlson is divorced and finds Marla to be a very attractive woman. In terms of ethical guidelines, if Dr. Carlson accepts Marla's invitation, he will be a graduate student. There's a power imbalance there. Oh, God. I mean, go Marla. Shoot your shot. If Carlson accepts, acting ethically as long as he does not become sexually involved with Marla until she is no longer affiliated with the university. Acting ethically as long as Marla is a student in a department other than the psychology department and will not be taking any classes in the psychology department. Acting ethically since he is not the one who initiated a potential relationship, clearly violating ethical guidelines. I want to say clearly violating ethical guidelines, but I'm going to say acting ethically as long as she's a student of another discipline. Yeah, because they emphasized his department. So I'm going to say that. Okay. A couple brings their 10-year-old. Why would a teacher, like, yeah, anyways. A couple brings their 10-year-old son to therapy at the suggestion of his school counselor, who is concerned because the boy has started arguing with his teacher and getting into physical fights with his classmates. After several sessions with the boy and his family, you receive a letter from the school principal requesting information about the boy's condition, and a signed release from the boy's parents is included with the letter. As an ethical psychologist, you should, okay. A couple brings their 10-year-old son to therapy at the suggestion of his high school counselor, who is concerned because the boy has started arguing. Okay. After several sessions with the boy and his family, you receive a letter from the school principal requesting information about the boy's condition, and a signed release from the boy's parents is included with the letter. As an ethical psychologist, you should refuse to release the records to anyone but a licensed psychologist, refuse to release the records to anyone but the boy's parents, release only the information you believe to be relevant to the school's concerns, release photo, yeah. Because the parent signed consent. So students in an introductory psychology class are required to participate in one of the university's ongoing research projects. This practice is students in an introductory psychology class are required to participate in one of the university's ongoing research projects. This practice is ethical as long as students can choose to participate in an alternate activity instead, as long as students are free to choose the research project they obtain from students before they participate. As long as informed consent is obtained from students before they participate. I'm going to say informed consent. We'll just say that. All right. Okay. The 1976 Tarasoff decision established, I don't remember. All right. Okay. The right of a parent to inspect the request modifications to their child's school records, a psychologist's duty to protect the intended victim of a therapy client, the 80% rule as a standard for determining the fairness of a selection test or other employment procedure, a psychologist's duty to report suspected or known cases of child abuse. A psychologist, Tarasoff. I think I remember reading this, but I don't remember. A psychologist's duty to protect the right of a parent to inspect and request modification to their child's school record. I'm going to say B, because I have no idea. When a psychologist learns that a colleague has committed an ethical violation, the psychologist may choose to ignore the violation if it is unlikely to be repeated by the colleague, must report the violation to the ethics committee or state provincial licensing board, may attempt to resolve the situation informally by discussing appropriate do so, should contact the colleague client to ascertain the no, probably this one. The ethics committee is investigating a complaint against a psychologist and requests by letter that she provide the committee with information about the complainant. The ethics committee is investigating a complaint against a psychologist and requests by letter that you provide the committee the information about the complainant. The complainant is a former client of yours that you stopped seeing 9 years ago. As an ethical psychologist, you should respond promptly to the committee's request and disclose only information relating to the complaint, or respond immediately to reply all requested information. But only prayer. Oh, yeah, probably this one. Okay. The owner of a small advertising agency refers an employee of the agency to Dr. K, a clinical psychologist, for an evaluation. The owner states that he believes that believes the employee is too thick-headed to be a benefit to the company. The owner and Dr. K agree prior to the evaluation that the psychologist will report back to the owner and advise if additional training may improve the employee's job performance. The psychologist prepares a report for the owner after several sessions. The owner consequently decides to terminate the employee based on this report and the employee's previous work history. The employee is very upset with Dr. K for not informing him about the purpose of the evaluation. Here, the ethics committee. The committee is likely to oh, I didn't even think about that. Dismiss the complaint, since in this situation the psychologist could not reveal the purpose of the evaluation to the employee in order to obtain accurate information. Dismiss the complaint, since complaints can be filed only by the clients of psychologists. I'm gonna guess C. I'm gonna guess C. Research on job satisfaction suggests that it is an enduring disposition that is minimally affected by job changes, is unrelated to being treated equitably. No, is a poor predictor of longevity, has a positive correlation with turnover. Research on jobs suggests that it is a poor predictor of longevity, is unrelated to being treated equitably. Okay, we're gonna say D, even though D is worded weird. Okay, we're getting there. We're getting there. A group's performance on a task is limited by the performance of the least skilled or knowledgeable member of the group. A group's performance on a I'm gonna say conjunctive because joining. What are we on? Industrial organizational psychology. Okay. Expectancy theory predicts that worker motivation depends on several factors, including valence, which refers to valence shells. That's physics. Okay, valence. The employee's beliefs about the value of rewards provided for successful performance, the employee's beliefs about the inherent intrinsic value of the work itself, the strength of the worker's motivation and organizational commitment, the strength of the effort versus ability component of the worker's motivation. Okay. The employee's belief about the value of rewards provided for successful. I don't think it's inherent or intrinsic value. I'm gonna say A, but we'll see. All right. According to Fiedler's contingency model of leadership, high LPC, least preferred coworker leaders, are always more effective than low LP. Okay. Contingency model of leadership. High LPC, least preferred coworker. High Elicit less intrinsic motivation. Okay, that's an absolute, so we'll do, yeah, so we'll do something about eliciting less. We're gonna say D, because I have no fucking idea. Trust makes sense too. An organizational psychologist finds that his newly developed selection test has different validity coefficients for male and female applicants, and that the difference is statistically significant. This suggests that the test has differential validity because they use the word different. Why am I wearing a bag? Am I wearing a bag? Oh, I'm not wearing a bag. It's a harness. That's so funny. I think I have 119. No, that's okay. I'll probably have extra time. But I'm doing an assessment exam to figure out where my knowledge is for the EPPP, which is an examination that registered provisional psychologists take to become registered. I hope that answers your question. But I am a little behind on time. Actually, no. No, I am. No, that's okay. In organizations, the 80% rule is used to determine if a selection procedure is having an adverse impact. 80% rule, a performance appraisal measure has adequate utility, a performance appraisal measure has adequate relevance. In organizations, I don't know what the 80% rule is, used to determine if I'm gonna just say C, because I don't know. I don't know the difference. Okay. Lewin's force field theory describes a planned change in organizations as involving which of the following stages? Force field theory describes planned change in organizations involving which of the following? Probably Lewis's force field theory. I'm gonna say B. I don't know. The primary purpose of a realistic job preview is to The primary purpose of a realistic job preview is to, I don't know what a realistic job preview is, increase the number of applicants for a job, develop an accurate job description. I'm gonna say B, that makes the most sense. Donald Super's blank graphically depicts the correspondence between an individual's life roles and life stages. We'll say life staircase. I have no idea. A transformational leader uses framing in order to make the organizational goals more meaningful to employees, clarify the consequences of undesirable performance. Transformational leader uses framing in order to B, you reduce personal bias because you're framing something. We'll say that. Okay. The best conclusion that can be drawn about the 4-day compressed work week is that it has long-lasting positive effects on attitude and productivity. I don't think it's negative. Positive effects on attitudes, but little or no impact on productivity. Positive effects on attitudes initially, but over time, increasingly negative effects on both attitudes and productivity. I'm gonna just say A. According to Hearsay and Blanchard's situational leadership model, employee maturity is a function of the employee's that one. Okay. Assessment centers in organizational settings are most commonly used to we're gonna say managers because it's organizational. That's my guess. ATB. Yeah. Yeah, you're right. Or I guess AATBS, if that's what you're talking about. I could be completely wrong. The paired comparison technique is used to organizations. The paired comparison technique is used to, I guess I should try to, I'm sorry, I'm not watching the comments, everyone. I feel really bad. I'm trying to take the test, but I thought to hold myself accountable, I would stream it, but I realize it's probably a bit counterintuitive. Okay. In organizations, the paired comparison technique is used to we'll say C. I have no idea. Oh, there we go. That's back. Okay. The rational economic model of decision making. I actually am so terrible with the organizational psychology aspect. The rational economic model of decision making is based on the assumption that something rational. Decision makers place more emphasis on the costs of certain decisions than on the consequences of their decision. Okay. Decision makers place more emphasis on the costs of certain decisions than on other consequences of their decisions. That makes the most sense, but I'll read the rest. Possible alternative is always incomplete. No, individuals are better than groups at making decisions. No, it's about economics, so money. Decision makers have complete information about all alternatives and their consequences before making decisions. Okay, we're going to say A because it has cost and that's about economics. The primary purpose of a blank is to obtain detailed information about job requirements in order to facilitate decisions related to compensation. The primary purpose of a blank is to obtain detailed info about job requirements. Obtain detailed information about job requirements in order to facilitate decisions related to compensation. We'll say job evaluation. An organizational psychologist would most likely recommend the use of vestibular training for which of the following jobs? An organizer would most likely recommend the use of vestibular training for which of the following jobs? I don't know what a vestibule is. What are vestibules? Depending. This is going to be a guess. We'll just say airline pilot because I have no idea. If you were hired by a large company to develop a new training program, your first step would probably be to conduct a. If you were hired by a large company to develop a new training program, your first step would probably be to conduct a. A new training program. We'll say needs analysis. Okay. A manager who follows the principles of scientific management would be most likely to agree with which statement? A manager who follows the principles of scientific management would be most likely to agree with which statement? We'll say that. I have no idea. In the context of Holland's RIASEC model, which I have no idea what that is, refers to the difference in the magnitude of scores on magnitude of scores an examinee obtains on the 6 personality types. The difference in the magnitude of scores. Probably differentiation. That because congruence is like when it's similar or like they align. Yeah, we're gonna go with that. All right. The highest levels of learning and performance are usually associated with moderate levels of arousal, high levels of arousal, variability, and probably variability, highest levels of learning and performance. I think variability would make the most sense. I actually don't know. What is the best way to mitigate the halo effect? Make the results of all available to employees, involve raters. I actually don't know, so I'm just going to do the longest because I have no idea. Which of the following would be least useful for eliminating the halo effect? Fuck, I don't know what the halo effect is. The central tendency bias and other rater biases from performance ratings. Well, this would be nice to have seen this question before. Oh, wait, I can go back. Okay. Which of the following would be least useful for eliminating the halo effect? It's the central tendency bias and other rater biases from performance ratings. So it's about performance ratings. Okay, we'll say train the raters. Okay, thank God I could go back. Okay, which of the following would be least useful for eliminating the halo effect? I'm gonna say paired comparison. Comparing it. And An employer can refuse to hire older workers only when there is a much larger proportion of younger than older job. When previous experience with an older worker has suggested that they cannot perform the job successfully, the younger age is required due to the nature of the job. When the employer hires older workers for the other positions in the company. I'm gonna say that. I don't think you can discriminate against age, but that's just a guess. I genuinely don't know. Because there is a lot of discrimination when it comes to okay. Both involve exposure to an which of the following do implosive therapy and flooding? Which of the following do implosive therapy and flooding have in common? Both involve exposure to an unconditioned aversive stimulus. Both are based on counter conditioning. Negative reinforcement. Both lead to extinction of the undesirable response. I actually don't know. Bandura's social cognitive theory predicts that cognitive events act as intervening variables in the acquisition of a new behavior. Social approval is a powerful primary reinforcement. Reinforcement has a greater impact on learning than on performance. The acquisition of new behaviors is a result of internalized SR connections. I don't think it's that one. We'll say C. I got no idea. All right. According to Albert Ellis, maladaptive behavior is caused primarily by which of the following? Ellis. I'm gonna say D. I think. Okay. Elmo, age 5, has learned that if he has a tantrum at mealtime whenever his parents want him to eat food, he doesn't like his parents will let him eat something else instead so that he will stop crying. In this situation, the parents' behavior, letting Elmo eat something. Avoidance conditioning. That's my guess. All right. Learning. Oh man. Okay, we're getting there. In Pavlov's research with animals, he found that dogs began to salivate in response to a tone after the tone had been presented repeatedly with meat powder. In this situation, the tone was a conditioned stimulus because the tone was added. Samuel, age 43, says, even though I've just been given a bonus at work, I feel like I'm about to be fired. As defined by Aaron Beck, Samuel is exhibiting which of the following cognitive distortions? Oh, arbitrary inference. That just makes the most sense, but I don't know for sure. Or it could have been personalization. Oh, I can go back. Even though I've just been given a bonus at work, I feel like I'm about to be fired. Arbitrary inference. That makes the most sense. Okay. Research on the serial position effect provides support for the distinction between A serial position effect. Serial position effect, distributed and parallel. Okay, we'll say that because those are giving positions. I don't know. I genuinely don't know. I'm so fucked. Okay, when using the Premack principle to modify a behavior, the reinforcer is a behavior that occurs frequently, a generalized conditioned reinforcer applied intermittently. Honestly, I have no idea. Oh, this is gonna be fun. I'm scared to find out the results. Okay. A behavior therapist working with a child who bites her nails sets a timer so that it rings every 5 minutes. The child is then given a reward for every 5 minute period that she doesn't bite her nails. The therapist is using which of the following techniques? I'm gonna just say the Premack principle because I have no idea. John Watson found that after little Albert had been classically conditioned to respond with fear to a white rat, the child also responded with fear to other white furry objects. Little Albert's reaction to, oh, generalization. Yeah, I know that. All right, so that's one. Okay. Dismantling studies have found evidence that which of the following principles is attributable to the effectiveness of systematic desensitization as a treatment for anxiety. Say extinction? That makes no sense. Maybe higher order conditioning. Honestly, I have no idea. Damn, I'm screwed. All right. The technique known as stress inoculation training consists of three overlapping phases. These are stress. We'll say this one because yo, I'm so sorry, everyone. I hope if you are watching, I'm sorry I'm not paying attention to the chat. I tried to decrease the other web page, but yeah. I guess I could just share my screen so you guys can see what I'm looking at. I kind of feel bad. Here, I'll share my screen. Okay, we'll share that. There. Now you can see what I'm doing. Okay. When using a continuous schedule of reinforcement to increase the occurrence of a desirable behavior, you would be most concerned about which of the following? I have no idea. Reinforcement to increase the occurrence of desirable. You would be most concerned about which of the following? Sensitization. I have no idea. Which of the following best describes elaborative rehearsal? Oh, I think it's thinking out loud while studying. Well, what I'm doing. Oh, I think it's this one, consciously repeating new information. That's my guess. But we'll see. The law of effect. I don't remember. I'm gonna just say Tolman. It's yeah, sorry, dude. children living in a residential facility are rewarded with a specific number of tokens each time they perform desirable behaviors, but must return a certain number of tokens when they engage. I want to say response cost. I have no idea. The process of gradually removing a prompt until it is no longer provided. Fading. That makes the most sense. We'll find out. Okay, findings from studies comparing participants' ability to recall the list of words they had memorized based on whether or not they were allowed to sleep following memorization. Findings from studies comparing participants' ability to recall a list of words they'd memorized based on whether or not. Maybe Tracy. I got no idea. Used chimpanzees as his research subjects in studies designed to investigate the role of cognition and learning. I actually don't know, man. My brain. Okay. A friend describes what the hot fudge sundae you are eating reminds him of in the most disgusting terms he can call to mind just as you begin to eat. He does this several times until he can no longer continue eating the sundae because it makes you feel sick. This situation has a closest resemblance to the following techniques. Covert. Maybe operant. I don't know. The phenomenon known as blocking will occur in which of the following circumstances? Oh gosh. The CS is presented prior to the US until a CR is established, and the CS and the US are presented. I'm gonna say that. I have no idea. Okay. Children experiencing peer rejection versus children subject to peer neglect experience which trajectory when changing schools? School change has no effect on the peer status of neglected children, but may have beneficial effects on the. That's my guess. That's just hoping. Okay. Aging causes what change in the focal point of the eye? I don't know. I don't know. Okay, we're almost done. We're getting there. Current theories consider emotional contagion to be the earliest manifestation of empathy development. This behavior emerges. Say about 6 months. The intellectual disability associated with PKU is preventable with. Oh, I learned about this in nutrition. A special diet? I don't remember. Independent, self-confident adolescents, according to Baumrind and colleagues, are most likely to have parents who are independent, self-confident adolescents. No, authoritative. Shit, I always mix up the difference between authoritative and authoritarian. I think it's authoritarian, that's the good one. We'll find out. What are we at? About 1 hour. We're at almost 2 hours. Babbling ordinarily begins at about 4 to 5 months of age and initially includes we'll say morphemes. I have no idea. I think it's phonemes, actually. I think it's phonemes. All right. Children obey rules during the second stage of Kohlberg's pre-conventional level of moral development because they feel they have a personal duty to uphold rules and laws. Everyone else is doing it. Doing so helps them avoid punishment. Doing so helps them satisfy their personal needs. Maybe punishment, I don't know. A 16-month-old child who calls her pet cat Kitty sees a dog for the first time and calls it Kitty. The child is displaying in Piaget's theory of cognitive development. It's either assimilation or centration. We'll say assimilation. Because I don't know. It might be centration though, but I have no idea. All right. Children's successful adjustment to the divorce of their parents is most related to the frequency of contact with the non-custodial parent, the quality of the parent-child relationship prior to the divorce, understand the cause of the divorce, the degree of post-divorce conflict between them. Probably that. Probably that. That's my guess. Okay. Thomas and Chess's goodness of fit model predicts that maladjustment in children is due to yeah, I don't know. Stranger anxiety begins in most children at about, say, 8 to 10. No, maybe 2 to 3. Because me and my cousin as babies didn't like strangers. Okay. Alice, age 14, is certain that everyone is looking at her because she has a large blemish on the middle of her forehead. Alice's belief, according to Elkind, is a manifestation of self-conscious emotions, a personal fable, social referencing. Audience. We'll say that. I have no idea. I don't know what Elkind talked about. Interactions between elements of the microsystem between the family and the school are part of the blank. Oh, shit. I remember this model, but interactions between elements of the microsystem between the family and the school are part of the we'll say mesosystem. I don't remember. The age range of Erikson's blank stage of psychosocial development corresponds to Freud's phallic stage. Oh, shit. I remember studying this, but I don't remember. The age range of Erikson's blank stage of psychosocial Freud's phallic. Because it goes oral. Shit. Shit. Is phallic the third stage? We'll do autonomy. I don't remember. Damn, I got so much to study. A child with an insecure avoidant pattern of attachment is very distressed when separated from is very distressed when separated from their mother and continues to be highly anxious when she returns, is more anxious when their mother is present than absent. No, is very distressed when separated from their mother, but pulls away from her when she returns. Yeah, 7. Shows insecure avoidant. Yeah, it's that one. I believe so. We'll see what happens. Konrad Lorenz's research on imprinting led to the search for twilight in human infants. A critical period of attachment, a biological explanation for language acquisition, a sensitive period for social referencing, a biological mechanism for recognition. Okay, it's not that. Critical period for attachment for social referencing. I'm going to say attachment. Okay, blank is a key contributor to aggressive behavior in children, according to Gerald Patterson and his colleagues. Blank. Aggressive behavior. Probably the child rearing. Nah, that's my guess. Child rearing. Okay. The blank is the least developed area of the brain at birth. Limbic system, I don't think so. Cerebral cortex makes the most sense. Okay. Most babies say their first words at about blank months of age. 9? I actually don't know. I don't have a baby. All right. Children begin to deliberately and regularly use rehearsal, elaboration, organization as memory strategies by blank. I actually don't know. I'll say 9 to 10 because, yeah, beats me. Blank involves intellectual disability and extreme obesity and is caused by chromosomal deletion. Extreme obesity? Caused by chromosomal deletion. I actually don't know. I didn't remember, but I remember learning about it. The rooting reflex occurs when damn. Okay, auditory localization in children is fully developed by 2 or 3, does not begin to develop until the 8th or 9th month. It has fully developed by around the end of the first year. Shows a birth and development during the preschool years. I actually have no idea. Maybe we'll say that one because I have no idea. Okay, factors that predict adolescent drug use in Shelder and Block's longitudinal studies include probably early experimentation. That's my guess. Most infants take their first steps with support at about I'll say 12 to 13 months. I got no idea. Shit. Okay, considering the Rosenthal effect. Oh, I've heard of this, but I don't remember what it is. Students described to teachers as academic successes are likely to be mistreated by fellow students. Probably anxiety. That makes the most sense. Which of the following is a true characteristic of sleeping patterns of older adults? A delayed sleep phase, an advanced sleep phase, a decreased need for sleep, increased REM sleep. Probably, I'm gonna say that. I have no idea. Hypothyroidism is associated with depression, emotional lability, unrealistic fears and doubts, and impaired concentration, agitated paranoia, confusion, hallucinating delusion, lethargy. So hypothyroidism means that it's not working as much. I'm gonna say B, 'cause honestly, I don't know. A patient is shown a flower in her left visual field and touches it with her left hand. She is then shown the flower in her right visual field and touches it with her right hand. This suggests that the woman has experienced damage to which of the following areas of her brain? A patient is shown a flower in her left visual field and touches it with her left hand. Oh, right, because it's supposed to crisscross. So not the amygdala, probably not the hippocampus. It's either cerebellum or corpus callosum. Corpus callosum and cerebellum are both close to the occipital lobe. Um, oh no, it's the corpus callosum. The corpus callosum is the middle thing. Is it? No, I think it is. I'm gonna say it. My gut is saying that. Okay. The blank is a key structure in the mediation of conditioned fear. Amygdala, because that's for emotions. I could be wrong. When an individual sustains damage to the frontal lobe, which is our thinking brain, which of the following is least likely? Preservation, inability to express language, right-left disorientation. Frontal is least likely to occur. We'll say that. I have no idea. Which part of the brain plays a role in the etiology of seasonal affective disorder? What part of the brain plays a role? Yeah. We're just gonna pretend like I don't know. Well, I don't know. Huntington's disease, I don't remember. I think it's women that get this. I think it's an X-linked disorder. Disinhibition, distractibility, and behavior changes are most associated with damage to the blank lobe. Disinhibition, distractibility, and behavior changes. Occipital is eyes, temporal, frontal, parietal. I think it's either temporal or parietal. I'm gonna say temporal. What time? Okay, I'm at 2 hours. Am I behind? Oh, we'll see. Okay. Which response is consistent with the I don't know who that is. I think, therefore I am. No, that's not him. My heart is racing, therefore I'm scared. It's noon, so I must be hungry. That was a great birthday surprise, so I must be happy. Oh, we're going to say that. Okay, a 34-year-old female with a moderate intellectual disability is accompanied by a staff from her group home. The client presents with acute onset confusion, disorientation, combative behaviors, and appears to be responding to internal stimuli. She denies substance use, and the group home staff corroborate this. Which of the following is the best fit first course of action? Probably assess for other symptoms of a schizophrenia spectrum disorder and refer to a psychiatrist for psychopharmacology. Okay, it's either A or D. Yeah, probably D, because, yeah. Which of the following is true for someone with Broca's aphasia? Fuck, I always don't remember the difference between Broca and Wernicke. Shit. Pronunciation is impaired, comprehension is seriously impaired, and it is difficult to name objects. Uses mostly nouns and verbs. The content of speech is grammatically correct, but often nonsensical. I think its comprehension is impaired. Yeah, that's my guess. I have no idea. I don't remember. It's been so long since I studied this stuff. Okay. A blank seizure is typically seen in children and characterized by periods of inattention, lapses, and awareness of staring. Oh, I've heard of these, but I don't know. We're going to say simple partial because I have no idea. Okay. Agraphia, acalculia, finger agnosia, and right-left disorientation are symptoms of which of the following? I have no idea. Because they're all, yeah, we're just going to say that. Okay, left temporal lobe damage causes which of the following symptoms? Word recognition, difficulty and impaired verbal memory, poor judgment. I'm going to say poor judgment. I actually don't remember. All right. Which of the following drugs is most likely to produce anticholinergic effects when administered at therapeutic doses? You need to know what anticholinergic effects are. So I don't know. So we're just going to say that. We'll say fluoxetine because I know what that is. It's for depression. Which of the following is an inhibitory neurotransmitter that also possesses analgesic properties? Endorphins, because I have no idea. Wait, inhibitory. So maybe GABA or glutamate. We'll say GABA. That was my guess in my head. Early memory loss associated with Alzheimer's disease is believed to be caused by deterioration of neurons in the hippocampus that secrete dopamine. I could be wrong though, because dopamine was for dementia, not Alzheimer's. Oh shit, was it GABA? Okay. Early memory loss associated with Alzheimer's disease is believed to be caused by deterioration of neurons in the hippocampus that secrete. Fuck it, we're saying dopamine. I don't know. All right. Okay. Damage to the hippocampus is most likely to interfere with the ability to retrieve long-term memories, manipulate memory information, convert short-term memory to long-term memory, store memories. I don't remember what the hippocampus was for, so I'm going to say that because I don't remember. Eating foods containing tyramine while taking a monoamine oxidase inhibitor is contraindicated because which of the following can occur? Say increase. Okay. Wow, this is actually making me feel really stupid. Okay, which of the following is a second-gen antipsychotic? We'll say risperidone. The ability to recognize the color of an object despite changes in the lighting is defined as which of the, wait, say that again? The ability to recognize the color of an object despite changes in the lighting is defined as which of the following? Color constancy? I don't know because it stays the same. That's my guess. Okay. Individuals who have sustained a moderate to severe traumatic brain injury are most likely to experience I actually don't know. Experience retrograde and anterograde amnesia, and as memory returns, they're most likely to recall remote events first and then slowly experience. Okay, we are just going to. I honestly don't know. 2 hours. What class of chemicals prevents apoptosis? Oh, I don't remember. What class of chemicals? We'll say neutral. I don't remember. It's not prolactin. It's either leukocytes or neurotrophins. Because it's not axons either. I think it's the first one. Okay, which part of the autonomic nervous system facilitates vegetative non-emergency responses? Which part of the autonomic nerve facilitates vegetative non-emergency responses? Okay, so you got the CNS. So you got the CNS, which is the brain and the spine. So CNS is brain and spine. Autonomic nervous system. So that goes into periphery. So it's either sympathetic or parasympathetic. Sympathetic is activation, parasympathetic is not. So it's that one. Okay. Benzodiazepines, if I don't get that one right, benzodiazepines with a short half-life can cause which type of amnesia for a short period after the drug has worn off? We'll say retrograde. I like the past. I don't know. Okay, a split brain patient with colossal syndrome would likely be able to verbalize the word spoon after it has been projected to his left visual field. Repeat a series of letters that have been whispered in his verbally identify an odor. So some colossal syndrome. I think it's that. I actually don't know. Yeah, we're gonna say that because I have no idea. But that makes the most sense. All right. A psychologist is attempting to assess the general intelligence of a 6-year-old child with a severe hearing impairment. Which of the following tests would be most effective? I don't do this. So, not an intelligent. Oh, general intelligence. Oh, all right. Never mind. A psychologist administers the Wisconsin card sorting test in Halcyon or patient with brain damage. For brain damage, the psychologist likely believes that the patient has Wisconsin card sorting test. Psychological battery. We'll say frontal. I don't know. Because it's thinking. That's my guess. Okay, a 29-year-old client completes the WACE 5. The results show verbal comprehension index, visual spatial index, fluid reasoning index, working memory index, processing speed, executive working memory, 85. Okay, which interpretation is more consistent with his profile? Honestly, I don't know. I'm just have to guess. I'm gonna just do the longest one because I have no idea. because I'd have to know it and I don't know it. The Peabody Picture Vocabulary Test was designed as a measure of receptive vocabulary for we'll say that excuse me because I have no idea. Okay. Which of the following scenarios best illustrates the concept of incremental validity in psychological testing? There's a lot of words. Which of the following scenarios best illustrates the concept of incremental validity? Incremental validity. I'm gonna say this because incremental. On the Rorschach ink blot test, confabulation is most suggestive of which of the following? Confabulation. I actually don't know. Okay. The IQ concordance rate for biological non-twin siblings who are reared together is the IQ concordance rate for biological non-twin siblings who are reared together is I don't know, 7. I feel like that's kind of I don't think that's right. Can we go back? My gut is saying 45, but even that, I don't know. All right. In the case of Larry P versus Riles, the court ruled that IQ tests are culturally fair. That is incorrect. That can't be right. Are racially and culturally biased? Probably. Are valid measures of intelligence for members of minority groups when administered by an examiner of the same race ethnicity? I don't think so. Are valid predictors of job performance or for members of minority when used in conjunction with other measures? I'm gonna say B. I don't think so. IQ tests, or maybe it's C. Maybe it's C, because I doubt, because people like to be like that things aren't racist. So, okay, the Bender Gestalt 2 is a measure of, I don't know. Okay, I'm at 2 hours. A psychologist administers the MMPI-2 to a 36-year-old man who exhibits a number of symptoms suggestive of neurosis. The man receives a very low case scale score. On the basis of his score, the psychologist can tentatively conclude that the man I don't know. I actually don't know. I don't know anything about assessments because I don't do assessments. Anna is in the process of buying a new car and is having trouble deciding between two cars that are similar in terms of both positive and negative characteristics. In other words, Anna is facing a blank conflict. Anna is in the process of buying a new car and is having trouble deciding between two cars. Probably approach that just makes logical sense. Okay, Mary thinks her teacher is a real jerk for always assigning weekend homework. Mary's belief about her teacher is best explained by which of the following? Over-justification, self-serving, fundamental attribution, self-verification. Maybe it's that. I remember reading this, but I don't remember. Which of the following best illustrates de-individuation? I don't think so. In a group decision-making situation, there is a tendency for critical thinking to be suspended when group cohesiveness is very strong. De-individuation. A group decision-making situation, there is a tendency for critical thinking to be suspended. A usually quiet, reserved person acts uncharacteristically violent in a crowd because he is able to do so anonymously. That's my guess. Because de-individuation. No, it's making you less of an individual. A group member reduces her effort. De-individuation. Probably C, actually. Because you're taking away your individualized, like your individualism. Okay, that's my guess. With regard to attitude change, inoculation is useful for anxiety. We're going to do that because there was an earlier question about something inoculation and it was about anxiety. Superordinate goals have been found useful for I actually don't know. I'll say that. Okay. According to Byrne's self-perception theory, I don't know. People experience discomfort when their behaviors are not consistent with their attitudes, beliefs, or values. And that makes sense. People enhance their own sense of self-worth by associating or identifying with others who are successful. People tend to attribute their successes to dispositional factors and failures to situational factors. People infer their own attitudes and emotions by observing their behaviors and the circumstances in which those behaviors occur. Self-perception theory. I think it's D. Okay. The tendency to seek out and interpret information in ways that verify our existing beliefs is referred to as a tendency to seek out and interpret information in ways that verify. Yeah, confirmation bias. Okay. The theory of planned behavior predicts Attitudes are the result of behaviors. Attitudes are the result of subjective norms, behavioral intentions, and behaviors. Behaviors are the results of attitudes. Behaviors are the results of attitudes, subjective norms, and behavioral intentions. Shit, I don't know. I'm gonna guess D. All right. Okay. The three components of attitudes are I actually don't know. Maybe that. Affect, behavior, cognition. Yeah, I don't think aptitude makes sense. Okay, individuals who frequently view violent TV shows tend to fear their environment more than those who view less TV violence. Fear their environment somewhat less than people who report being less frequent viewers. Fear their environment much less. Report being less frequent viewers are about equal in terms of fear of their environment to people who report being less frequent viewers. Individuals who frequently view violent TV shows. We'll say that. Okay, a researcher would use the randomized block ANOVA to analyze collected data in order to evaluate the effects of one or more independent, I think it's that one, effects of independent variable. We'll say D. I have no idea. Okay. If a researcher has found heteroscedasticity in a scattergram, they have found that there is statistically significant correlation between the criterion criterion. The variability range of scores on the criterion varies for different scores on the predictor. There is a restriction of range of scores on the predictor and or the criterion. The relationship between the predictor and criterion cannot be described by a straight line. Heteroskedasticity. Okay, because hetero means opposite. There is a restriction of range of scores on the predictor. The variability range of scores on the variability range of scores on the criterion varies for different scores on the predictor. There is a statistically significant correlation between I think it's B or C, just based off of the wording. I think it's C. Okay. Could be A, but I don't know for shit. Okay. Researchers usually prefer parametric statistical tests over non-parametric tests because they are more powerful. This means that the use of a parametric test to analyze collected data in a research study helps ensure that researchers usually prefer parametric statistical tests over non-parametric because they are more powerful. This means that the use of parametric tests to analyze collected data in a research study helps ensure that I don't remember what the null hypothesis means. Oh, okay. We'll just say that it's rejected because I genuinely don't know. Which of the following techniques would be most useful for obtaining information on the cognitive processes used by students while they solve complex problems? What would be the most useful for obtaining information? Situation sampling. I don't know. Of 100 students surveyed on a college campus, 48 voted Republican and 52 voted Democrat in the last election. On another college campus, 63 of the 100 students surveyed voted Republican and 37 voted Democrat. Which of the following statistical tests is the appropriate technique for determining if there is a statistically significant difference in voting preferences at the two colleges? We'll say a chi-square test because I don't know. When the relationship between the predictor, the x variable, and the criterion, the y variable, is curvilinear and both variables are measured on an interval or ratio scale, the appropriate correlation. Oh shit, I don't know. I'll just say phi. Maybe I'll say tau. Because this is just a guess at this point, because I have no idea. I don't know what any of them means either. The magnitude of the standard the magnitude of the standard error of the mean increases as, I don't know. The sample size increases and the population variance decreases. The magnitude of the standard error of the mean increases. The mean, oh shit. We'll say C, because I have no idea. Autocorrelation is most likely to be a problem when using which of the following research designs? Yeah, I don't know. I don't have any. When using multiple regression, multicollinearity occurs when there is a low correlation. Multiple regression. We'll say this one. Okay. You would use the Solomon four-group design in order to we'll say this because I have no idea. Starting to lose my confidence. The hallmark of true experimental research, in contrast to quasi-experimental research, is that a researcher would a distribution of 250 scores is positively skewed and has a range of 1 to 50. In this distribution, which of the following is an accurate description of the measure of central tendency in relationship to one another? Median mode. Okay, a distribution of 250 scores is positively skewed and has a range of 1 to 50. I don't know what any of these mean. I forgot. We'll just say C. Whew. Okay, so I still have like 45 minutes. Okay, so at least I know I can complete the test within the allotted time. When using stepwise multiple regression to explain the greatest amount of variation in Y, using the fewest possible X variables, U. Multiple regression. I'm going to say this one because that's what I feel like I think I remember. Okay. A group of 250 high schools achievement tests. The test mean was 50, its standard deviation was 5, and the test scores were normally distributed. If you wanted to use test scores to select the top score at, okay, oh God, give me a second. The test's mean was 50, its standard deviation was 5, and the test scores were normally distributed. If you wanted to use test scores to select the top 16%, you would set the cutoff score. Yeah, I don't fucking know. When a test's reliability has been estimated by splitting the test in half and correlating scores on the two halves, you would use which of the following to correct the resulting reliability coefficient? Yeah, I got no idea. These are guesses. Okay. Which of the following would be useful for determining the extent to which an examinee's actual criterion score is likely to deviate from the predicted criterion? I'll just say this because I got no idea. An educational psychologist designs a screening test to identify underachieving first and second grade children who have a learning disability. The psychologist should be most concerned that her test has adequate construct. I don't know. Okay, an assumption underlying blank is that observed covariation among a set of variables is due to one or more underlying common dimensions. I feel we'll say multiple regression, or it could be factor analysis. An item discrimination index of blank indicates that all examinees in the high scoring group and none in the low scoring group answered the item correctly. When predictor's reliability coefficient is 0.81, its criterion related validity coefficient can be, oh shit. I actually don't know. I really don't know stats. In test construction, shrinkage is associated with We'll say this. Okay. The slope of an item characteristic curve indicates which of the following: the item's ability to discriminate between high and low achievers, the item's level of difficulty, the susceptibility of the item to social desirability effects, the probability that the item can be answered correctly by guessing. Oh, we'll say A, because that's my fucking guess. I have no idea. When assessing the test-retest reliability of your newly developed personality test, you obtain a reliability coefficient of 0.80. This means that where does 64 come from? I don't fucking know. We'll say it's that, because I have no idea. Okay, how long did it take me? 2 hours and 30 minutes. We're going to submit all and finish. Yeah, that's fine. Okay, I can pause that. So 2 hours and 34 minutes. God damn! All right, but okay, so I can share my screen, I guess. I don't need to. It is what it is. I appreciate anyone that showed up. Thank you for your time. I apologize for not looking at comments. I'll have to fix that if I do continue to live stream. I do talk a lot, so I talk to myself a lot, so I do apologize if that is bothersome. But yeah, other than that, I have a good night. Bye.